Now, from an antenatal perspective, our laboratory probably handles about 7,500 to 8,000 screening antenatal booking samples per annum. So we've got a huge capacity. What's really great to appreciate is that when we receive these samples, typically from healthy ladies when they present for their antenatal pregnancy care, is that we receive a sample from them about maybe between 8 and 12 weeks gestation. When that sample comes to us in the laboratory, it's a sort of 10 ml sample of blood which will then clot, and the clot then settles to the bottom, and you have something called serum separation gel which rises up as it's centrifuged, which means that you're then left with a clean aliquot of serum on the top and all the clot, the fibrin strands and the cells settled at the bottom. What this fancy conveyor belt does is then take a clean aliquot, it takes a portion of that serum from the top and allows us to store it. And most laboratories, depending on capacity a little bit, can keep those stored quantities of serum for about 3 years. What that means is that if you add a hepatitis C antibody test to a standard pregnancy sample and you find that antibodies are present, what you've probably got is a little aliquot in your freezer to be able to go to and do additional testing for, whether that is confirmatory antibody testing, whether it's a PCR test to work out is there current virus present, and if there is, to go on to do a test called a genotype, which will tell us what type of Hep C is there and therefore what drugs do we need to be using.